All right, let's get started. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry update with Boulder County Public Health. We do have a special guest speaker this week that will be talking about the COVID-19 variants and the business response to that. In addition, we will also talk about our regular updates in Dial 3.0 with Lane. We're going to start first, though, with a COVID epidemiologist, Rebecca Herman.
Thanks, Corinne, and thanks for having me today. So today I wanted to talk about some of the COVID-19 variants that have been circulating in the community. I work specifically with some of the businesses here in Boulder County who are experiencing outbreaks of COVID. So I'll talk about how that can impact some businesses and steps you can take to prevent that. So today I'll talk about just some background about variants, what those are, and really what that means. The process that we use in public health to identify cases of variants. And then I'll talk about how those variants can affect your business and some of the general infection prevention protocols that we recommend having in place. So to give some background, viruses like SARS-CoV-2, which is the virus that causes COVID-19, are reproducing very quickly. And as they do that, they accumulate genetic mistakes or mutations. And some of those mutations are advantageous to the virus. They can actually help it infect us better. So a lot of those mutations that we've seen occur in the spike protein, which is the little point on the surface of the virus. And that's the protein that the virus uses to attach to human cells and infect them. So these mutations help them become better at infecting us. They're associated with higher concentrations of virus in the body, and that leads to these variants being more transmissible than previous strains. So they basically outcompete some of the older strains and spread very quickly through our communities. So the CDC classifies variants in 3 different ways. First, we have variants of interest that have been identified, and they're basically just being monitored and studied to see if there are any particular concerns. If there are, we call them variants of concern. That would require an increased public health follow-up for a variety of reasons. And we also might have variants of high consequence. None have been identified to date, though. So to get a little more into the specifics of those different classifications, so a variant of interest often has some genetic markers that we associate with a virus that's more transmissible or might cause more severe disease, but we're still studying that and we don't have a lot of evidence. They also might be variants that are not very common in the United States at this point. Variants of concern do have evidence of at least one of the following factors. That would be an increase in transmissibility, that they cause more severe disease outcomes, that they may cause vaccines to be less effective, or that they may evade our testing and that we might not be able to diagnose them as easily. And then finally, variants of high consequence would significantly reduce the effectiveness of our prevention measures or any medical treatments for the disease. And again, we have not identified any of those variants. So public health will follow up on variants of concern and high consequence. And here in Colorado, as of last week on March 23rd, these were the numbers of variants that we had identified. So often in the media, you'll hear variants referred to as the name of the place where they were identified first or where they're most commonly circulating. So we have a couple of variants of interest, B1.525 and 526 that came out of New York, and P2, which is associated with Brazil. So we've seen a few of those cases. But more prevalent are the variants of concern. So we have B1.351, which is often referred to as the South Africa variant. You'll see we have around 20 cases that have been identified in Colorado. But the most common variant that we've seen is B.1.1.7. That's being referred to as the UK variant. And we have over 400 confirmed cases. And you'll see that we have many suspect cases. The S drop is a genetic marker that basically alerts us that this is likely a case of B.1.1.7, and it has to undergo further testing to be confirmed. So you can see that confirmed and suspect cases of B.1.1.7 are the most common variants here in Colorado at this time. We also have B.1.427 and 429. Those came out of California and initially were variants of interest, and then were upgraded to variants of concern because they are much more transmissible. And then finally, P1, which is another variant associated with Brazil. We haven't seen any cases of P1 in Colorado so far. And again, no variants of high consequence identified in the United States. So in public health, to actually identify these variant strains, we have a number of ways to do this. So first, we have a sentinel surveillance system that's put in place by the state health department, CDPHE. And this is a number of hospitals and labs that participate across the state. They will submit a random sample of all of their positive COVID-19 tests to the state testing lab. And the state can look for certain genetic markers that indicate that those are variants. That's about 10 to 15% of the total positive COVID tests statewide go through that program. And they're mainly looking for B.1.1.7. Other labs also have the technology to identify some of those variants, again, B.1.1.7, because it does have this genetic marker that we can identify. So in total, about 30% of the state's positive cases are being screened for variants through those two programs. In addition to that, the state also does whole genome sequencing on about 3% of the state's total tests. And that helps us identify variants aside from B.1.1.7 that might not have as obvious of genetic markers. So because only a smaller percentage of our tests are actually being screened for variants, the numbers that I shared on the previous slide don't represent the total number of variants circulating in the state, and we believe those numbers are actually much higher. These are some labs that we recommend people getting tested at because they do have the technology to identify the UK variant, B.1.1.7. So that would be any Mako Medical Lab site. So here in Boulder County, that's at Stasio Ball Fields in Boulder, or the Boulder County Fairgrounds in Longmont. We highly encourage anyone who's looking to get tested in Boulder County to go through these sites. They're free. You can just drive up. You can register online and see your results in an online portal. And they have the ability to check for the B.1.1.7 variant. So we're really encouraging people to use those sites. So this is just a little case study of some of the variants. There were 72 cases between January and February of this year that the state kind of did a deeper dive on. The cases in question ranged in age from 1 year old to 94 years. Slightly over half were male. Interestingly, only 13% reported travel outside of Colorado, and none of them reported international travel. So this indicates to us that these variants are circulating in our own community. You don't need to travel to another state or another country to get infected. And notably, 99% of these cases were symptomatic, which is higher than we've seen previously. Quite a few cases in the past have been totally asymptomatic. So that's new. 13% of these cases were hospitalized, and then 1% died from the disease. So in terms of how these strains can affect businesses, mainly we're just seeing that they are dramatically more transmissible and infectious. So if you have an employee who works while they're infectious with a variant of the virus, you can see that spread very quickly. I've been working with some businesses experiencing outbreaks associated with a variant, and employees can get infected much more quickly than before. So it is very important, especially because we know that 99% of variant cases do experience symptoms. If an employee is feeling ill, experiencing any COVID-19 symptoms, they need to stay home. That's very important. But also we know that people can become infectious to others 2 days before they show any symptoms. So we need to have infection prevention measures already in place in businesses to stop that transmission in its tracks. So if you are notified that an employee of yours tested positive with a variant strain and worked while infectious, the first thing to do is to conduct extensive contact tracing within your business. So you'll want to see if anybody, either employees or patrons, was in contact with this person for a cumulative total of 15 minutes or more and within 6 feet of distance. If you do identify those close contacts, they need to be quarantined, and we strongly recommend that they quarantine for a full 14 days. They also need to be tested. So they should be tested on day 7 of that quarantine. And again, that needs to occur at sites that have the ability to detect variant strains. So that would be one of those Mako medical sites in Boulder County. And if you identify further illness in your facility, other people experiencing symptoms, or if other people start testing positive, notify public health right away, and we can help you walk through that process and support you and make sure that we can prevent further transmission. Some steps to put in place now, if you haven't already, that can help prevent infection in the first place would be, first of all, conducting symptom screenings with your employees. So this would be just a list of COVID-19 symptoms that they should check for before coming into work. We recommend doing this virtually as well, so sending out an email or a text to your employees so that if they are experiencing any symptoms, they can answer that at home, so they haven't even come into work yet. Temperature checks are also important for employees and patrons, anyone entering the business. And you can ramp this up and do this multiple times per day, especially for employees. You might want to screen them twice per shift, because we do know that sometimes people will be at work and then start to feel ill. And if that happens, they should be sent home right away. Masking is, of course, still very important, making sure that your employees and your patrons are wearing their mask that covers their mouth and their nose at all times. And social distancing, so making sure that even if an employee is taking a break, that they're far away from other people, especially if they're going to have their mask off to eat or drink. We also recommend stricter cleaning measures, making sure that you're using EPA certified disinfectants and you can start cleaning more often. And increased airflow, a really easy way to do that as the weather gets nicer is just propping open doors, opening windows, in addition to HVAC systems and HEPA filters. And finally, one of the most important factors is making sure that your employees are educated on all of these steps, that they know what symptoms to look out for, that they know not to come into work if they're feeling sick, and that they're following all of these infection prevention steps, whether or not there's a manager there, so that these steps are being followed at all times. So I just wanted to address a few frequently asked questions that we get. So we've heard people asking whether variant strains last longer on surfaces than non-variant strains. Unfortunately, don't have an answer for that. Those environmental persistence studies are still ongoing. It is possible that variant strains could last longer on surfaces. So again, we do recommend increasing how often you're wiping down surfaces and making sure that you're using those certified disinfectants. Others have asked about shortened quarantine options for employees exposed to the variant case. So some of those options include a 10-day quarantine with no test, and a 7-day quarantine with a negative test result on day 5 or later. We strongly recommend against using those shortened options if an employee or patron has been exposed to a variant case, because the risk is just so much higher with the variants. They're much more transmissible. So the risk of someone getting sick on, day 11 or 12 of their quarantine, but they're already back to work, we don't want to risk that. So we really recommend having a full 14-day quarantine for those folks. And then finally, the question that everyone wants to know is whether vaccines work against variants. So again, a lot of those studies are ongoing and evidence is coming out every day about how they work against variants. But so far, the results have been promising, and studies are showing that the vaccine should be effective against the variants as well. I'm going to leave you with our contact information. So if you have questions about employees who are ill or want to report a possible outbreak, you can reach us at COVID-19 EpiLine. And if you have any complaints or regulatory concerns, you can reach out to the COVID Biz email. Thank you so much. And if you have any questions, I think those can go in the chat.
I will, I'll ask you, we do have a couple questions directly for you, so I will ask those and then we'll move on to Lane. So specifically, if you get a COVID test but test negative, will your test be included in the variant testing?
Yes, so if you get tested at one of those Mako medical sites, they're screening every single test for the variants. So if you test negative, then you don't have a variant because you don't have COVID at all. But if you do test positive, that's where they'll look for certain genetic markers to indicate that it's a variant. But yes, all those tests are being processed the same way.
But a negative test doesn't necessarily mean you don't have COVID at all. It just means you don't have it at that point in time. You still need to quarantine for that full time period, correct?
That's correct, yes.
Okay.
So if you have been exposed, even if you do get a negative test, we still are strongly encouraging people to quarantine for the full 14 days. Yeah.
Now the state site does say if you are vaccinated, that you're not required to quarantine. Is that correct with the variants as well?
Yeah, so as of right now, that's still correct. That's the guidance that has been put out and that we're following. Because we have seen evidence that the vaccines are effective against the variants as well. If anything were to change, that would be updated on the state site and widely publicized as well.
Okay, so there's a lot of confusion. So let's say I'm doing my symptom screening and I have a symptom and I don't come into work that day. How long do I need to stay away from this facility? How long do I have to stay away from work even if my symptoms go away?
That's a good question. So it would kind of depend on the situation. If you had a known exposure to somebody with COVID, you would need to quarantine for 7, 10, or 14 days. Again, we would ideally want you to quarantine for 14 days. If you did not have a known exposure, we'd want you to go get tested if you're experiencing symptoms. And at that point, if your test comes back negative, you would be able to come back into work. But if someone is still symptomatic, with fever or more moderate to severe symptoms, we'd still want them to stay home from work until their symptoms have improved. Whether or not it's COVID, we don't want to be spreading disease, but you can also consider if the symptoms are lingering, getting another test. But we would say, yeah, if your symptoms go away and you've gotten a negative test, then and no known exposures, then you should go back to work.
Same with, clientele at a dance studio or, your clients, some of those similar types of things too. We get a lot of questions about that. No known exposure. I said I had a headache. Do I have to stay away for 14 days? Type of questions.
Yeah, so with something like a headache, obviously that can be caused by many more things than COVID. So once that symptom is improved, you're good to go back to work. We would be concerned, or back to a studio. We would be concerned about, symptoms that, a combination of symptoms or symptoms that are really indicative of COVID. A lot of people, especially, coming into allergy season now, people have had, just like a runny nose and really mild symptoms when they had COVID and confuse that with allergies. So I would say someone's best bet is to go get a COVID test. And once they have a negative result, and if it's mild symptoms that are improved, then they can come back to, work or a studio. But we want to make sure we're taking all those precautions, even with mild illness, because that can be COVID sometimes. So we want to make sure we're catching that.
It's rare that we have an epidemiologist on the call, so I'm taking some of the pressure off Lane today. So you talked a little bit about cleaning of hard surfaces and products and a little bit more. We have a question that came in about the quarantining of soft goods and what the recommendation still is about the soft goods and the variants on soft goods and the non-variants on soft goods. Is the recommendation still a quarantining of soft goods for a period of time? How long do you have to keep those in quarantine if right now still?
That's a good question. I'm actually not sure. Maybe if we could get the person's email who asked that question.
I have it. So.
Yeah, that'd be great. I can find out for you and follow up by email.
And we haven't changed any of those as of yet. So again, I think with the variants, it still has that lingering question. We don't believe there's a lot of fomite exposure and transmission. So surfaces being the major route of exposure, and especially from kind of clothes, but we're still keeping those recommendations for those types of things.
Okay. What was the time frame for the number of variants found in Colorado? Someone missed that date.
That was since the first variant was identified, and I believe that was in mid-December. So that's a cumulative total of all the variants that we've identified since then. We started off with a few cases here and there, and we're starting to see many more, especially of B117, unfortunately.
All right. What would be a more ideal percentage of cases to test for variants as opposed to the 10 to 15%?
I mean, ideally it would be 100%. I don't know if there's a really great, threshold. Really, we're just wanting a representative sample. And so that's why we're encouraging as many people as possible to go through the Mako testing sites. Other sites just don't have the same technology to be able to identify some of those genetic markers. So I know that the state has really ramped up their capacity and their state lab to look for that as well. So I'm hoping that we'll be able to increase the numbers of tests that can get screened, but not everybody has access to a Mako testing site as well. So there's equity questions there in certain areas of the state where people just can't have that option. So, at this point, we're basically operating as these variants are spreading rapidly. We want to get as many people tested through Mako or the state lab as possible, but we know it's not a reality to get 100% of the tests screened.
Okay, I'm gonna ask you two more questions and then we're gonna move on to Lane. And if more questions come in for you, you've agreed to stay on for a little while. So you had can you go back to the slide about what to do if you do have an identified case with the variant? Right there. So you said, determine if there are close contacts of this employee. How far back from when that person started seeing symptoms, or 2 days prior to when they got tested?
Yeah, that's a great question. So if the case in question, so if the person who tested positive has shown symptoms, we would want to find out, okay, when did you start feeling sick? When's the first day you started feeling symptoms? And we'd want to go back 2 days before they started feeling symptoms. So if I started feeling sick on Friday, we'd be concerned about anyone who was around me on Thursday and Wednesday, and then anybody who was around me Friday, and then 10 days on from that. So, you know, some people still will just have like a runny nose or something, and they'll come to work thinking like it's no big deal. So maybe they were at work for a few days while they had symptoms. We'd want to identify anyone who was in contact the 2 days before symptoms started, and then up to 10 days after. If that person has shown no symptoms at all, then we would use the test date instead. So the day that they got tested, 2 days before that, and 10 days after.
So, and at that point, you'd want to use that full list of symptoms. So the headache, because that might have been an indication at that point
right.
for that person. Okay.
Right. So at that point, yeah, when someone started feeling a headache or a little achy or runny nose, yeah, even if it's mild symptoms, we want to look at when those started and use that as that key date.
I'm not sure if you can answer this question. At my husband's work, one of his employees that has had the vaccination, I don't know if it's both rounds, just tested positive for COVID. Is that because of the vaccination, or does he actually have COVID? He was not symptomatic. He just participated in a weekly required testing.
Yeah, so it would, we have seen what we would call vaccine breakthrough cases. So that's when someone who has been fully vaccinated, so either 2 doses of Pfizer and Moderna or 1 dose of the Johnson & Johnson, and then they've been fully vaccinated for 2 weeks. If they test positive after that point, we call it a vaccine breakthrough case. Unfortunately, the vaccines aren't 100% effective. They're very effective, but they're not 100%. So we have seen a few rare occasions where someone does test positive after getting the vaccine. We've also seen people test positive after getting their first dose or right after completing the series, because we don't think that full immunity sets in until 2 weeks after completing the series. So we still want to treat that person like a true positive case. We want to have them isolate. We want to quarantine anybody who was in contact with them. It's pretty rare, but it is possible for that to happen. So for those of you who are about to get your vaccines or are kind of in the middle of that process, continue to take as many precautions as possible, because unfortunately people still can test positive during that time.
Thank you, Rebecca. Okay, Lane, let's switch to you. Dial 3.0. And we had some more questions come in, but I think they're going to be they're related more to Lane, your presentation. So we'll ask them after you go through yours, because you might actually answer them.
I will definitely try. All right. Good afternoon, everyone. We're going to run through our epi data. We'll talk a little bit about where the dial is, and a little bit about 5-star, and again, have time for question and answer at the end. So we continue to be in yellow. This is actually a little bit of a concern. We thought very certainly we were likely to head into blue many weeks ago, and we've actually started seeing trends moving the opposite direction. So it definitely is not a time to be lax on our precautions. So the biggest one is our case counts continue to climb. So this was around 100. As you remember, weeks and weeks ago, we were dipping into blue where we were below 100. And about a week ago, we were around 110. Earlier this week, we were at like 132, and now we're at 144 as of this morning. So again, trending the wrong direction for case counts right now, putting us pretty solidly in the yellow, no longer really kind of hovering around the moving into blue. Positivity is the same trend. So unfortunately continues to climb. We are still in the blue metric there, but starting to get close to moving into yellow. So this was about 3.6% around a week or so ago. So again, pretty big movements in the wrong direction on the last 2 metrics. Hospitalizations has been fairly stable. We've seen this kind of fluctuating, but typically in yellow, but around that 7 to 11 days of decreasing or stable admissions. So again, here's the case count tracking since the beginning of the virus. And you can see near the end of that graph, we have started that uptick over the last several weeks. So again, this is really where we're having a lot of concern is, you know, we're at about 63 cases per day. And that's about 52 per day for last week. So that's a little over 10 cases a day that we've jumped up. So again, seeing those concerns. Municipality wise, Boulder has seen a little bit of an increase from where it was in past weeks. 26% of our cases in Longmont, 45% in Boulder. So kind of total case counts, 175 cases in the city of Boulder, 91 in Longmont, 44 within Lafayette, Louisville, and Superior, and 61 within our other municipalities and unincorporated Boulder County. For our disparity kind of tracking, we have still continued to see disparities in the Hispanic Latinx community. In the last 7 days, about 15.4% of our cases have been among the Hispanic Latinx community. So that actually is still doing better than where we were much earlier in the pandemic. So 14% of our population identifies in that demographic. So we're getting a little bit closer to what would be representative there, but still seeing that disparity. Here's just another graph of that over time. Again, it's definitely shrunk from where it was earlier. But again, that's still something that we're continuing to track and still targeting, especially with vaccination efforts. So one of the reasons why those trends have gone in the wrong direction is really the social distancing and what's being tracked on overall people's mobility. And so there's a percentage captured on how well people are doing at social distancing and staying at home versus being out and about and very active. So as those percentages go down, then we're seeing more and more potential for disease. So we continue to see pretty significant drop-offs in that. It's not a total surprise as the weather gets better, but unfortunately with the strains and the virus still being present and not having enough of our population vaccinated, we're still at significant risk for disease transmission. And this is tracked based on people's mobility from their smartphones and devices. So here's where we're at vaccination wise. We have over 107,000 Boulder residents vaccinated. So between either their single first dose or for those that require a 2-dose to be completed. So we are moving well down there. I think folks know that as of tomorrow, the entire population phase 2 starts. So everyone is eligible. So if you haven't been eligible yet, that eligibility starts tomorrow. So vaccinations are going to be very challenging to get, I think, for a little while until we see the big flow of vaccine make it to our county. For population wise, here's where we're at overall percentages for full and partial. We've done a significant number of our high risk populations, and now we're working in those other phases. And again, starting tomorrow, it'll be all of our population. But over 90% of the population that's over 70 has received at least one vaccine. So that, again, that's one of our higher risk populations. So that is very good news. And again, I think we've seen the results of that by a lot less impact to our long-term care facilities and hospitalizations and deaths. For the metro area, so the 50 plus population is one of the specific ones in the 1B4 current phase. And so about almost 50% of the metro area have been vaccinated. So a fairly good percentage there. And then we certainly expect to see those numbers continue to climb as really the entire population is opened up. We're also continuing to track where we're seeing areas that have lower vaccination rates. And so we continue to target those with our clinic efforts as well as disparate populations. So we're continuing to use a lot of the data that we get to help inform us on where we need to do more targeted vaccinations. So again, key takeaways here, we've got those rising case counts. So we're not out of the woods yet. We don't want to really pull the plug just yet. And we need to really get our population vaccinated. Again, as you heard from Rachel, that the vaccines do appear to be effective. So that is more and more reason to get it as we see these variants become more and more prevalent. We really want people vaccinated so that we can kind of end this pandemic. I mentioned the disparities that we're still seeing, although there was a decrease in March compared to where that was in February. So at least things are going in the right direction there. Over 37% of our population, so that 107, that's what it represents relatively within our community. But then those testing numbers, we're seeing higher positivity, and we're seeing a little bit of a decline in how many folks are getting tested. So that's not a good trend of less tests and higher positivity. Again, time spent at home has definitely decreased. So more and more people are out and about. So risks are continuing to be there. And then the most alarming thing, I didn't mention this, but we're also tracking a lot of other metrics that are relevant to the pandemic, and the trends in suicide attempts among Boulder County residents remain very, very concerning. So we know the pandemic has had significant financial impacts within the business community, but it's had significant mental health issues and impacts across all of the country and the world. So we know that is an important piece, and we really want to make sure people are seeking mental health assistance whenever they need that, and doing it proactively, not reactionary. So I mentioned this vaccine, phase 2 opens tomorrow, and that's the rest of the population. So everyone should be eligible by tomorrow. And we have a couple of different resources beyond just our call center. We're making sure folks are aware of the state website and the state call center number where you can get more information. But our call center in Boulder County is helping facilitate people to get onto the various networks because it's very, very much web-based for people to get signed up. And so some people need more assistance there. So we definitely want to encourage people to reach out to get that assistance. All right, we're going to switch gears into the dial, which is what kind of impacts you and your businesses. As of right now, the state face covering order is still in effect. It is set to expire because it expires every 30 days. That's kind of the limited power the governor has. We are hopeful and expecting that it will get renewed until May, but that is still remains to be seen. And as of right now, we still have our local county as well as municipal mask orders. So nothing hopefully will be changing on the mask front. Vaccinated persons, I think you heard a little bit about this with what we need to focus on there, but there is an expectation that people who are fully vaccinated may not need to quarantine. So that's just one of the factors there. But for folks who are higher risk, we want to make sure that they know they should still be taking those precautions unless they have been fully vaccinated. Even then, it's still be advisable to make smart decisions, but we do believe that people who are fully vaccinated should not have the same risk of getting disease. So minus those breakthrough cases, which have been fairly small amount. There have been some changes. Won't get into all the nuances on backsliding, but as of right now, we haven't made it to blue, so we're not as worried about the backslide. So we unfortunately can't quite get over that to get into blue. So I'm going to talk to you a little bit about what has changed within the dial statuses. Again, hopefully looking forward to where we might get, but as of right now, we're still pretty solidly in yellow. So last call was moved to 1 a.m. for those businesses. We will talk about blue for all the 5-star businesses. Personal social gatherings are subject to the CDC guidance. So really that's focusing on people's ability to maintain social distancing, still encouraging mask wearing and hand washing, but there are not set limits on personal gatherings. There are some site-specific variances permitted for indoor events, but we'll worry about those for folks can reach out to our business team to talk through some of that stuff. And I'm not probably going to talk about as much the changes to orange and red since we don't believe we're going to really be going anywhere near to that extreme. If unfortunately we see significant changes in our tracking, we'll make sure to revisit that. But as of right now, we're still looking forward and hoping we actually make it to blue and even green. So for our 5-star businesses, here's kind of where things are at in blue. And again, hopefully as a community, we move to blue. But still the qualifications are pretty much the same. And then there is a change in positivity. So they have increased that. So as our unfortunate trend goes up, that may not jeopardize us for blue for that metric. Capacities, really looking at outdoor events, you're now just focused on social distancing. So having the ability to be 6 feet apart, that's really going to be the driver for your capacity limits for those outdoor events. Indoor personal social gatherings, again, same as it was before. It's not set up. There's no set limits. It's just focused on your ability to social distance. Non-critical office-based businesses are now at 75% posted occupancy. And again, that's fire marshal posted occupancy. Limited healthcare and personal services, 50% posted occupancy, not to exceed 50 people per room. Restaurants, while it says 100% posted occupancy limit, there still is the 6-foot distancing, so tables being 6 feet apart. So we know that is the big driver, and that still is going to be the limiting factor for capacity within restaurants. Outdoor spaces, again, their ability, group limits of 10 people in the dining party, and then 6 feet apart for the tables. So again, as you have space to continue to add tables, you can continue to add more folks, but that limitation has not been removed. Smoking lounges are allowed to be at 50%, not to exceed 25 people. Indoor events at 50% occupancy, not to exceed 175 per room, assuming the room can accommodate that many folks. And then where there are seated events, you can increase the capacity up to 225. Organized rec or adult sports can have 50 participants. Bars are allowed to be at 25% capacity, not to exceed 75. So again, this is a change for that sector. And then green, we're not there, and we're not really close to qualifying for that, but this is where we start to see a lot less restrictions, but not necessarily everything being removed. And again, we'll spend more time on that as we see that moving forward, but we are expecting additional dial changes. So I'm not sure if we'll actually make it to green before the dial changes again. So probably not going to spend a lot of time on that. 5-star, I'll kind of turn this over to Corinne to share any updates she has or information she wants to on 5-star.
I know there was a lot of confusion in the Dial 3.0 changes for 5-star businesses. I've communicated with each of them those changes. You can operate in blue. So there were a lot of changes for the blue, and yes, that 100% capacity while still maintaining the 6 feet between tables was a little bit of a confusion. I got a lot of emails about that. So we know that space just doesn't allow that. Gyms, you did get to increase your capacity quite a bit. There's still a lot of benefits to being part of the 5-star. We do have 60 businesses in Boulder County that are 5-star certified. The program's still available. Please contact me if you have any questions about it. And as we move forward, 5-star is an infrastructure that is in place that allows businesses to show their public health safety measures. It may evolve as the dial evolves, as the public health measures evolve, but it is an infrastructure that we have in place, and it is a locally controlled infrastructure. We do have an admin committee that is made up right here in Boulder County. It is not a state-controlled program. So I just want to put that out there for everybody. But yep, there are 60 businesses. They're all listed on the website, everything from manufacturing to office to personal services, restaurants, and gyms. We want to congratulate those businesses that have taken part in the program. And if you want to see them, they're on the website. Other than that, please continue to put your questions. We have a lot of questions coming in, so we'll let Lane continue on and we'll ask him his questions coming up.
Yeah, and I just, as public health, we definitely want to really put a plug in there of this is a way for businesses to proactively reduce risk. As Rebecca talked about with the variants, they're a lot more transmissible. That's a huge risk factor for you in your business to cause an outbreak, let alone lose all of your employees to an outbreak. So it's really important that you're taking these precautions. And we know that the businesses that have gone through this effort have dramatically looked at all those aspects and are reducing those risks. So it's really an important piece. Again, we're not out of it, let alone the incentive base for being in blue. I think everyone thought we were going to just make it to blue, so you didn't need to be a 5-star business. And here we are now in April, and we're still in yellow, and it's pretty solidly in yellow. So that incentive is still there as a driver, but on the public health side, we really want to support it because we want to reduce risks within our community as well as keep our businesses open. Still put a plug in for that exposure notification system. We've talked about this for many, many weeks, but it is a simple app for people to add that does give some really early warning that you've been exposed to somebody who tested positive. So pretty simple app to add. And it's, I guess, a nice assurance. I've added this a long time ago and never gotten any notifications. So it makes me feel very good that I have not been around sick people. So at least with COVID. This continues to be our schedule. We are not planning any webinar for Friday, but we do have that time reserved for any urgent needs. But again, our regular time here at 1 on Thursdays. And the Spanish language session that's pre-recorded will also be released today. And Rebecca talked about our contact. So there's our email again, as well as the call center for those folks that have questions and complaints, but certainly want to really support vaccinations, and they're doing a lot of support on getting people to vaccinations. And we can jump to questions.
All right, I'm going to group them. Let's start with the mask guidelines. So there's a lot of rumors out there about things changing, things expiring. So there's rumors that the mask guidance from the state will be changing or changing in general, and you covered that a little bit. But there's a lot of questions about what you anticipate seeing, how it differs between Boulder County and the state, and if the state does change it, what will Boulder County do? So if you could address that a little bit more. And if the state does change it, will Boulder County still keep theirs in place? How long? Kind of things like that.
Yeah, I would expect mask requirements for indoor settings to be something that stays in place. We certainly hope that the governor keeps that at the state level. So again, it remains to be seen. We'll know here very soon whether that mask order is extended or not. But it's hard for me to speculate whether that will happen or not. I would expect.
So, and there's no guarantee he's not gonna extend it one more month, because there's also the rumor that he's gonna extend it one more month, and it's actually May that he's gonna make those changes. So there's both sides of it as well.
Right. So, we're all speculating of what's going to happen. So we're just going to have to wait and see what happens. My hope is that he does extend it. If he does not, then I would expect Boulder County to keep our indoor mask order. It's the outdoor masking that, may or may not have more flexibility to be removed. So there are discussions around that. But as we know right now, the state order does not include anything outdoors. It's only indoor. So that would be the potential change at the local level, is if masks are no longer required outdoors when people are not socially distant.
And as a reminder, there are some municipalities that have orders as well. Louisville, Erie, Boulder.
Almost all of them do, yeah.
Yep, so they all have them as well. So we'll have to go back to that. Which municipality are you in as well? The state one was kind of our overarching, and it became the overarching order. At this point, if the state one changed, we'll have to go back and look at the municipality piece. Okay, I think I covered all the mask ones. So vaccinations, why open group 2 when we haven't gotten through group 1B?
I think you're asking the wrong person. We don't have a person present who's making those decisions. So, but yes, I think the challenges with vaccines are not enough vaccines for the quantity of people that need to be vaccinated. So it's gonna put a strain on those previous phases that have not gotten their vaccine yet, that they will be competing with really the entire population now.
Now, some of the providers aren't opening up group 2 right away. Like I just got an email that said, we're opening up 1B4 right now, and they're still phasing. They're saying, we're still prioritizing the earlier phases. So it might depend on the provider. And then there are those larger community sites that are available for that phase 2, which I'm trying to get on every list out there. I was just trying it out as part of my public service to this group to see how it is to get on these lists, just to see what it's like.
Yeah. And we know that it's going to be a challenge. It's already a challenge. Certainly, I would encourage anyone who is already qualifying in a previous phase, go online today and get yourself signed up. Don't wait until tomorrow when it becomes an even bigger group. So, again, if you're really struggling, use the call center as a resource. They have been able to help facilitate people to find appointments.
Speaking of which, can you go back to the slide that shows the vaccination?
The state or? Okay.
The state. And while you're doing that, someone said, thank you for speaking to the mental health aspects of all of this, Lane.
Yeah, I mean, we just know that there's just so many stressors in our community, some very, very recent. So we know that people are struggling. So it's really important that people take time.
And as a reminder, I do send out this link, this phone number, as well as the link to the state site on where to get vaccinated, the link to every county, all the different providers, as well as the community sites, and then the county site as well. So if you get an email from me, it should have direct links and all of this information for you.
And so
all right.
That's the number that's listed on this slide is the state hotline. So again, our local hotline is the one that I'm also encouraging people to use to help find local providers too.
All right. So do you see a future where restaurants will have some sort of ability to move less than 6 feet distancing?
Yeah, I have to believe that we're going to have a life like we had pre-COVID. So the timing of that is still the question mark. I think we really need to weather the current storms. We're seeing upticks in cases. We're seeing more and more variants. So again, it's not really the time to pull that plug just yet. But I'm confident that we're going to get there, especially with the help of our community getting vaccinated. So.
And speaking of that, there are lots of rumors going around that Dow 3.0 will be ending at some point, or that it will go through some massive changes, or things will go back to the county. What will Boulder County enact, or what's it looking like? What's the next public health order looking like? And will that take into consideration some of these changes for restaurants and some other industries?
Yeah, it's all timing based. So we expect the governor to sunset the dial. We just don't know when that will be. We're hopeful that that is not until May, but it could be in a couple of weeks. So it's all the same kind of game we've unfortunately been part of for a year now. Is we have to wait and see what those final decisions will be. I can tell you that the Metro Denver partnership is discussing those various scenarios. So if the all of the dial goes away here very, very soon, before we're really ready for it to, they will look at what is needed to still protect our communities in the interim. But again, those are all still speculation right now.
And point of clarification, if the dial goes away, that doesn't mean public health orders are going away. It just means that they're moving to a local level and more of a coordinated local level orders. It doesn't mean that everything's just opening up. It just means that the governor is getting out of the business of public health orders, correct?
Yeah, it depends. If they remove their public health orders, then the state public health orders do go away. So it kind of depends on what actions they take. Again, we know how to prevent disease. Rebecca shared extensively about that. We've been talking about it for months and months now. None of that has changed. It's really the same thing. So if people practice those things, we prevent disease. If we don't, we don't. And so we're not at a place where we have herd immunity at all. You can see that we're at 30-some%, 35% of our community, and we're doing better than many of the metro communities. So that is nowhere near herd immunity. So the more that people go back to normal before we're ready, we open the door to spreading disease, very rapidly, and allowing for the ongoing mutations. And, again, the concern that we eventually get a strain that is not going to be something that our vaccines are successful to prevent. So that if we get to that point, we are starting this entire pandemic over. And so that is something that we cannot let happen.
Okay. So for unseated indoor and outdoor events, do you still use the social distancing calculator, or do you follow other guidelines, CDC guidelines?
I mean, that is still, in our opinion, the best gauge for how many people you can safely fit in there and allow them to socially distance. So that is still your best tool. But the requirements simply say people need to be able to be 6 feet apart. And so that's kind of what the guide is. If you put more people in there than what the social distancing calculator says, you're going to have a difficult time for them to be able to stay socially distanced.
The social distancing calculator is technically 6 feet in all directions. So if they're not seated, they're going to be moving around, and that's 144 square feet per person. So it's allowing that movement of people. So it's a good gauge for you.
We know it's conservative, but again, if you start to do lesser and lesser amounts, you're going to reach points where you're not allowing people to socially distance. And indoors, we know that that is a huge risk factor for disease transmission versus it being outdoors.
All right, let's talk HVACs. I know you like HVACs. If there are no windows that open at a leased space of a business and their HVAC does not have filters, what would you recommend for improving air in a space?
I guess it would depend on what's going on in that space. I would encourage them maybe to have someone come out and look at it and maybe service the HVAC. I'm not sure why they don't have filters, but typically that's not a very difficult thing to add as a very simple and easy step. But making sure that it's balanced and it has enough makeup air that's fresh air intake. So that's an important piece. But just opening windows isn't sort of a magic solution to protecting folks either. So really those systems running effectively is more important than just being able to open a window.
And on the 5-star site, we actually have an HVAC checklist that lists possible ways to increase airflow and ways to service your HVAC that might be examples that you can look at to increase the safety of your HVAC and increase airflow. So that might be a resource for everybody to look at. And that has been vetted through some of the air quality control individuals in public health.
Yeah, the one thing that I guess I would discourage is just getting oscillating fans to put into place that are just blowing air around. That doesn't necessarily help protect folks. In fact, it can move air from one person's breathing space further to another person. So that's not something we've encouraged people to do, is just putting in fans. But some people have put in air filtration systems and things like that, but we're not necessarily telling everybody you need to take that step, but you can consult with some of those professionals to see if those make sense for what you're doing in your space.
Rebecca, I have one for you. All right. How about quarantining after traveling? If someone travels out of state on a commercial airliner, should they quarantine for a certain amount of time upon return to their home? Would the quarantine expectation be different if the trip were made in one's own vehicle with less contact with others?
Yeah, that's a good question. We don't have any requirements in terms of quarantining after travel. I can tell you my personal opinion. And if I was in that position, I would choose to quarantine after travel, particularly on a plane. And in that case, we do have a couple different quarantine options. We'd also recommend getting tested about 5 to 7 days after travel. I would say, yeah, driving somewhere in your personal vehicle is a much lower risk than traveling by plane. Not even due to the plane itself, but also just being in an airport around lots of other people. So if you are able to do some risk reduction in that way and drive instead of fly, we'd recommend that. So you're not required to quarantine, but you also might want to check with your workplace because they might have specific guidance and stricter guidance and want you to quarantine after travel.
So if I drive in my personal car to a beach, get on a sailboat by myself and do all that stuff, that's a different situation than me going to an airport, traveling, being in a public place. I mean, I think there's a lot of different risks that our people take in the travel. So I think there's not a blanket statement on that one particular question.
Definitely. There's kind of different degrees of risk, and you get to make your own choices. But if you're traveling and going somewhere outside your community, that always involves greater risk. So I would consider all your options and consider at least getting tested upon your return and quarantining if that's possible.
Okay. I work in a shared business building. We were told today everyone must wear a mask unless you are alone in your office, or if two people who are fully vaccinated are meeting, they do not need to wear masks. Have rules changed that if all people in one office are vaccinated, they don't have to wear masks?
No, no, that has not changed. If you are alone in an office, that has been consistent that you don't have to wear a mask then, assuming it's a closed door office. But there is not any allowance that vaccinated people don't have to socially distance or don't have to wear masks. That has not changed.
Any advice for precautions for camps for kids this summer? Recommending continued masking, distancing, limiting numbers, limiting households, etc. That's a lot of things.
Yeah, there is a lot. I think that the continued guidance that camps and childcare centers have been using is likely going to continue. So, and we know that population as of right now is not eligible for vaccines. We're hopeful that we'll start to see maybe 12 and up become eligible for vaccines. There's a lot of data that's already showing incredible high vaccination success for that age demographic. So we're very hopeful, whether it's by the summer or certainly by next school year, that we'll see a bigger portion of the students vaccinated. But for this summer, those campers will not be vaccinated. So their risks have not changed dramatically until we see our case counts and our numbers of illness in the community drop way away. So I don't expect a lot of changes there. And it's really important that they take all those same precautions, really thinking about limiting those pods so that if there are exposures, there's less quarantines needed. So I don't expect a ton of change there.
Okay. 3 more questions and then we'll let you go. And if Rebecca, if you have to leave, I think we're good. Do you know when we'll be able to open saunas? We have some elite athletes training for the Olympics that could really use them.
I'm not sure what category is prohibiting them currently. So
I have the email address, so we could look into that one and get back to them.
We can try to follow up because I'm not sure that there's a prohibition there. But okay. I would expect that will be something that will be available.
And then we're entering the summer months. In regards to swim lessons with instructors who are doing hands-on instruction with students, has there been any changes, and would vaccine status change this possibility in the future?
I think it could, especially if it's outdoor lessons, because we're likely going to see less requirements for masks outdoors. And certainly if they're a vaccinated instructor, that's at least removing a significant risk. Doesn't mean that they can't still get the virus. They may not be symptomatic or develop disease and then share it with others. So again, being vaccinated doesn't make you immune to exposure to the virus and sharing the virus. So I think that's the important piece, is it really prevents the person from getting sick, and certainly significant illness of hospitalization and death. So that's really why we want it, but it doesn't mean you can't be a risk factor for others, especially kids who are not going to get vaccinated. So we'll see on that one, but that would be the scenario I could see, as a vaccinated instructor outdoors potentially could be unmasked with kids.
But at this time, that is not a current condition that allows it.
Mm-hmm.
Okay. And then finally, can you speak to activities at the fairgrounds? The website states all meetings will remain canceled until social distancing is not a requirement. What are meetings? Does this include indoor craft shows and such?
I would continue to refer people back to the fairgrounds. That's managed by, a set of folks. And I think they're probably still taking very precautionary focus on what they will and won't allow. So, and I'm not sure what they're qualifying. My take on that would be it's all activities, not just a meeting of people. That would be other sort of shows and things like that. But they're likely to start to allow more activities there, but there is a whole set of folks that run and organize the fairgrounds. So I would refer folks back to those folks.
All right, I think we made it through all the email questions I got beforehand and all the questions we had come in. I want to thank you both. Thank you, Rebecca. It's a treat to have an epidemiologist on our calls. Lane plays one on TV sometimes and then refers them back to you all. So thank you for joining us today and educating us on the new variants. And we recorded it because I'm sure more people are going to want to watch it. I want to thank everybody for joining us, asking your questions. We'll continue to get more information as we know more about the new mask order changes, as we know about the future of Dial 3.0, we'll let you know. At this time, the answers aren't available right now. It's still up in the air. So we'll let you know, we'll communicate. Sometimes I try to over communicate, but I hope you appreciate we get you the information as soon as we can, as soon as we have it, as soon as it's clear. If you have any questions about 5-star, let me know. At this time, we'll see you next week. And you have the email addresses, you have the phone numbers in between. Get your questions answered. Thank you, Lane. Thank you, Rebecca. And we'll see everybody next week.
Thank you.
Thanks.